Have you noticed that your legs are weakening after the age of 60? To get to your feet, you might find yourself needing to push off your knees. Climbing stairs can start to feel like lifting weights. Occasionally, you might even lose your balance just crossing the living room. Most people assume this is simply part of aging. But here's the reality. It's actually one of the earliest indicators of age-related muscle loss, or sarcopenia. This change often happens silently, without pain or swelling, until you eventually find you need help getting out of a chair. But here's the good news. Research shows that leg strength can often be restored in a matter of days with just three important vitamins. No strenuous exercise, no expensive therapy, just the right nutrients at the right time. This video explains the three essential vitamins every senior needs, how deficiencies cause weak, heavy legs, and how to safely and effectively combine them for a quick recovery. This isn't health gossip or hearsay. It's supported by clinical investigations, real research, and decades of professional experience. Stay with me through to the very end, and I'll also share a vitamin regimen that most people overlook but is highly effective. The reality of aging muscles. After the age of 60, your body gradually undergoes noticeable changes. Your bones may break more easily, blood flow slows down, and your muscles, especially those in your legs, begin to weaken. Many people don't realize that the legs usually show the first signs of this weakness, making simple tasks like standing up or walking more difficult, even if you're eating normally and otherwise feeling fine. According to the American Geriatric Society, people over 60 lose 1 to 3% of their muscle mass per year. That means you could lose up to 15% of your leg strength in just 5 years without even realizing it. So why does this happen? There are three primary reasons. 1. Vitamin deficiencies. As we age, our bodies absorb nutrients less efficiently and produce less stomach acid, leading to deficiencies in key vitamins like D, B12, and thiamine, sometimes called vitamin B1. These are essential for nerve transmission and muscle contraction. 2. Poor blood circulation. Slower circulation means your legs get less oxygen and fewer nutrients, leading to early fatigue, frequent cramps, and the sensation of heavy, tired legs. 3. Reduce physical activity. Older adults tend to walk less and avoid stairs. Without proper nutrition, even regular movement isn't enough to fully restore muscle strength. The good news is that you can restore your leg strength in days by replenishing these three vitamins. Here's how. The three essential vitamins. First, vitamin D3, the master switch. Vitamin D3 is more than just another vitamin. It reactivates your neurological, skeletal, and muscular systems, acting like a master switch. Unfortunately, your body's ability to produce this nutrient declines sharply after age 60 due to thinner skin, slower liver and kidney conversion, and less time in the sun. Why D3 matters. Vitamin D3 helps your body absorb calcium for strong bones, but it also ensures your muscle fibers contract properly, nerve signals transmit smoothly, and muscle atrophy is avoided. When you're deficient, your body becomes weak and unreliable. Signs of D3 deficiency: leg weakness, especially climbing stairs, fatigue from standing or walking, leg cramps at night, trouble turning or moving quickly, pain in hips, knees, or heels. Scientific support: University of Birmingham, UK. Older adults taking 800 IU of D3 daily for 5 days increased leg strength by 19% in a few weeks. Harvard, seniors with low D3 were 40% more likely to fall or be hospitalized. How to take it. Dosage: 800 to 1,000 international units daily for healthy adults. 1,500 to 2,000 international units for those with frailty or a history of falls. Best time: morning or early afternoon with a meal containing healthy fats, e.g., salmon, eggs, olive oil. Warning: don't take it right before bed, can disturb sleep. Avoid excess, more than 4,000 IU per day long term, as it may cause problems. 2. Vitamin B12, restoring nerve health and balance. Vitamin B12 isn't just for energy and memory. It's crucial for the communication between your brain and muscles, particularly in your legs. When levels fall, you often first notice problems in your lower body. Signs of B12 deficiency: tingling, burning, or numbness in feet. Leg weakness, especially when standing or walking. Feeling unsteady or needing help to walk. Mood swings, mild depression, forgetfulness, or brain fog. Why deficiency is common. Stomach produces less acid with age, especially if you use acid-reducing medications, like omeprazole. Low meat or plant-heavy diets are naturally lower in B12. Scientific support. Oxford University, seniors with low B12 walked slower, had worse balance, and were twice as likely to fall. Clinical trials: 1 to 2 milligrams of B12 daily for 8 weeks improved balance, reduced numbness, and improved lower body strength. How to take it. Dosage: 500 to 1,000 micrograms, 0.5 to 1 milligram, of methylcobalamin daily. Best time: morning or with lunch, not with coffee or tea. Food sources: beef liver, salmon, eggs, milk, but not usually enough for most seniors, so supplements are often needed. Safety: very safe, even at high doses. Check with your doctor if you take blood thinners or have kidney problems. 3. Thiamine, vitamin B1, or vitamin bone, muscle energy booster. Thiamine, sometimes called vitamin bone, is essential for converting food, especially carbohydrates, into energy, ATP, that powers your muscles. Without it, muscles feel heavy, fatigue easily, and recover poorly. Signs of thiamine deficiency: weak or very tired legs, even with light activity. Muscle cramps, feet or calves. Heavy, dragging feeling when moving. Lightheadedness or fatigue after getting up. Loss of appetite or general lack of energy. Why deficiency happens. Reduced absorption with age. Diuretics and some antibiotics flush it out of your system. Even moderate alcohol use reduces absorption. Diets low in whole grains, legumes, or organ meats. Scientific support. Tokyo University, 2021. Over 30% of older adults studied had low thiamine and weaker legs. Supplements improved energy, walking, and stair climbing. Neurological Sciences Journal. 100 milligrams thiamine daily improved endurance in 82% of patients within 7 days. How to take it. Dosage: 1.2 milligrams per day, men, and 1.1 milligrams per day, women, is basic, but seniors with symptoms may need 50 to 100 milligrams per day. Best time: morning with food. Avoid alcohol, coffee, or black tea with it. Food sources: whole grains, legumes, seeds, pork, organ meats. Supplements often necessary due to low intake or absorption. Combining the 3 vitamins for best results. Vitamin D3, morning with breakfast that contains healthy fats. Vitamin B12, late morning or lunchtime with a meal, not with tea or coffee. Thiamine B1, morning with your first meal, preferably whole grains and protein. If you take a multivitamin, check the label. Many do not contain enough of these 3 for older adults. Always take vitamins with food for best absorption, and talk to your doctor before starting new supplements, especially if you have chronic illness or are on medication. Final safety tips. Don't increase dosages on your own. More is not always better. If you have kidney or liver disease, consult your doctor before supplementing. Watch for adverse effects: tingling, numbness, headaches, appetite changes. Get your vitamin blood levels checked every 6 to 12 months if you're taking supplements long-term. Conclusion. Aging doesn't have to mean losing leg strength, balance, or independence. D3 restores bones and muscle power. B12 sharpens your nerves and balance. And thiamine brings back your muscle energy. When combined, they form a powerful trio to help you regain your strength, confidence, and freedom of movement. Remember, it's not just aging. It's a fixable issue. Take the first step. Check your vitamins, talk to your doctor, and share your story. We learn and get stronger together.